So my name's Sam James. I'm a professor of respiratory medicine at University College London. So I want to talk to you about a project that we're really interested in, which looks at infrared spectral biomarkers. Now, what does that mean? What we think happens when people are perhaps at risk of cancer or even have a lung cancer is that many cells around the body just changed subtly. And what we're looking at is taking a few cells from the cheek. So we just take a little sort of smear of cells from inside the cheek, and we shine a special light source on these cells. And what appears to happen is that the cells inside the mouth just reflect light slightly differently if a person is at a high risk of having lung cancer. So we believe that in the future we might be able to develop this so that we could perhaps use it as quite a high throughput test, perhaps testing in GP surgeries or pharmacies people's cheek cells to see if they're at a higher risk of developing lung cancer. I think this project is really exciting. Currently we have CT screening for lung cancer, which can detect cancers really early, but it's quite labor intensive, quite expensive, and at the moment, not carried out in Europe outside of research projects or national pilots. And also CT screening will probably be limited to those at the very highest risk of developing lung cancer. And what we really need are what we call biomarkers, so markers in blood or breath or cheek cells that can perhaps point us towards those at high risk of developing cancer that also need to be scanned, perhaps wouldn't be normally. Because we need to remember, perhaps 1 in 5 lung cancer patients, is a never smoker, has never smoked. So they would never normally have a imaging screen or a CT scan. So I think this type of biomarker work is absolutely crucial and potentially really exciting.